Hi, myself Dr. Vamshi Krishna. I'm a consultant brain spine surgeon. I'm a founder director of Dr. Yasaswis Brain Spine Neuro Center and the Multi Speciality Center. Today, we'll be talking about the spinal cord, its function, its divisions, how to take care of your spine. So, this is the spine model here. This is the bony vertebral column. It is divided into cervical, thoracic, lumbar, and sacrum. And inside we have a cylindrical nervous tissue extending from the medulla oblongata to the conus medullaris that ends at the L1 level. And here we see the yellow structures. These are the nerves. The spinal cord have 31 pairs of nerves that supplies the body for the hand movement, for the leg movement, for the bladder control of all. And it is normally divided into cervical, thoracic, lumbar and sacral regions. Common causes that affects the spinal cord is cervical spondylosis, cervical spine tumors, spinal infections, and thoracic injuries where we have any transaction of cord contusions, many like congenital neural defects like myelocele, myelomeningocele, severe canal stenosis. Common conditions that can affect your spinal cord include cervical spondylosis. So cervical spondylosis is a progressive wear and tear of the spinal discs in your neck region that can press on the spinal cord leading to cervical neuropathy. Other conditions are herniated discs, when a spinal disc slips out of place and moves into the space around your spinal cord, pressing on nearby nerves. Spinal fractures are when one or more vertebrae are crushed, like compression fractures or broken burst fracture, and put pressure on your spinal cord. Spinal muscular atrophy is a genetic condition where people lose motor nerve cells in the spinal cord, causing muscle weakness and atrophy. And acute transverse myelitis is an inflammation in one or more segments of your spinal cord. And spinal stenosis is a narrowing of your spinal column leading to pinched nerves and spinal cord irritation. Spinal tumors are masses which may be cancerous or benign that start in your spinal column and can put pressure off in your spinal cord. Spinal infections, when the pressure of an expanding abscess or collapse of an infected vertebra or disc puts pressure on the spinal cord. What is the difference between the spinal cord and the vertebral column? People often refer to the spinal cord and vertebral column together as a spine. Your spinal cord is a band of tissues, nerves, and cells. A protective layer of bone called the vertebral column covers and protects your spinal cord. The bones in the vertebral column are called vertebrae. Your vertebrae stack on top of each other from your pelvic bone to your skull. Between each pair of vertebrae, you have a spinal disc. Discs have a tough outer shell and a gel-like interior. They act as soft absorption and cushion for your vertebrae and spinal cord. What tissues and fluids make up the spinal cord? Like your brain, layers of tissue called meninges cover the spinal cord. These protective tissue include dura mater. It's an outer layer that protects your spinal cord from injury. Arachnoid matter, the middle layer between the epidural and subarachnoid space. Pia matter is the inner layer that covers your spinal cord. Apart from it, you have a central middle nervous tissue constituted of neurons extending from the medulla oblongata to the conus medullaris, which consists of both motor, sensory, and autonomic fibers that controls your motor movement, that carries your sensory fibers to the brain, and also carries bladder functions. How can I keep my spine healthy? About the care of the vertebral column and spinal cord. You can keep your spinal cord, vertebral column, and entire back healthier by practicing healthy habits. Nutritious diet with good fruits, vegetables, grains, healthy fats, and lean proteins. Regular exercises, combination of aerobic activities, strengthening and stretching exercises. Practice good posture and avoid hunching while sitting or standing. Quit smoking and other tobacco products. Sleep in positions that support the natural curve of your neck and lower back. Walk often and take breaks throughout the day. Limit alcohol use and avoid recreational usage of drugs. For all your brain, spine, neuro, health issues and other illness, please step into Dr. Yasaswis Brain, Spine and Neuro Center and Multi Speciality Clinic. for your better brain and spine health.